Okay, I think I need to mute everyone. Some people are on muting, and it's worse when I have this earpiece on. Okay, can I 1 minute, please? Okay, yeah. So this is so much better. So my co-host, you can mute yourself when appropriate, as it is. Okay, so we'll have a special guest this evening in the room. We had a part one of this last week. How many of us enjoyed the part one of our testimony time that we had last week? We had our special guest from Zimbabwe. If you enjoyed it, please give us some reaction. Show some love. For those that were here last week Tuesday, we had a part one of this where we had testimonies from Zimbabwe, from South Africa, from Namibia. It was an amazing time out last week. I mean, most of the people here, were you not here last week? I'm not seeing reaction. Can we give some reaction, please? For those that were here last week, please support us now with an applause or a thumbs up or something. Yes. Okay. Yeah. Thank you. Thank you. Thank you. Okay. So we're having a part two of that. We know when Don Jeff was going to speak, we asked him to hold on because it was loaded. He had so much. And we decided that we're going to give him today to share all his testimony. But before we go into that, I would like to welcome everyone here this evening. They have taken out their time to join us this evening. We appreciate you and we celebrate you as well, particularly if it's your first time here joining us. We would like to acknowledge you. So if it's your first time, can you do a show of hand? There's a way you can do a show of hand on the screen. If you go to participants where your name is, under more, you will see where you can raise hand. You can raise hand there to show us it's your first time, or you can give us a thumbs up to show that it's your first. I say, okay, please, a round of applause. I'm seeing Anthony. Anthony, you are welcome. Abimbola Taiwo, you are welcome. I see Grace Aisha, you're welcome. Please, as I'm calling them, can you help us celebrate them with an applause? Just go to your reaction button and celebrate an applause. I see James the Dollar. James the Dollar, iPhone, please help us change it to your name so that we can call you by your name. I see Emmanuel Olusanjo Obasa. Thank you so very much for joining us to celebrate you. And trust me, you are on the best platform that you can be at this hour. And I do hope that at the end of our talk today, $20, you are welcome. At the end of our talk today, you will go home or you will get back with something that you can share with others to better the lives of others. We have seen what works, and it's our mandate at this point to spread the gospel. It's good news. So what we're simply doing is sharing from what we know. So that's what we're going to be doing again this evening for the next 2 hours. So we'll be wrapping up by 10, hopefully. 10, maximum 10:15, because usually we start at 8:15. Okay, so that's why we're here this evening, and we'll celebrate you for joining us. Also, please note that we would like to acknowledge you by your name. So if your device is showing, your device model is showing instead of your name, please help us change it to your name. So I can see iPhone, Techno Sparks, stuff like that. Please just help us to rename it and put your name there. And if you're a guest, you can go ahead and put the name of the person that invited you so that we know we invited you, and we can also celebrate that person for getting in here this evening. Okay, so we do have chat rooms as well. The chat room is where we ask questions, throw comments or suggestion or whatever it is. So if there's anything about what we're doing this evening that does not go down well with you, you can speak to the admin privately, but please don't chastise us in public. We're not saying we're perfect. We're just sharing what we know. Okay, and if you want to also celebrate us, and acknowledge what we're saying, you can give us a thumbs up with the reaction button. You can give us an applause. You can share some love with us. And if it's funny, you can laugh. And we do laugh a lot here because when we had our mental health talk, they told us that happiness, I mean, laughter is very, 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 very essential. So they say a day without laughter is a day wasted. So everybody should just laugh right now. Some people have not laughed today. The situation in Nigeria is not making anybody laugh at all, but we need to laugh. We need to laugh to keep healthy. So everybody should just give us the laugh emoji right now. Go to the reaction and just give us some laughter. Please go ahead, go ahead. I'm not seeing laughter. I'm not seeing laughter. Please laugh. There's no how you put this reaction button and you will not smile. You'll find out that you smile and it's good for your health. It doesn't matter what you're going through. Please show some smile, laugh it off. It is well. Okay, so of course, some of the testimonies can be wow. So you could just give us the wow reaction button. Wow, are you serious? Is this for real? That's what that is for. And of course, we also celebrate, we jubilate here as well. We are happy people, and we like to share our happiness. So that's what the reaction button is for. Okay, having said that, I think we are good. We're good to go. Are we good to go? Are we good to go?
Yes, yeah.
Okay. I wanted the reaction. Are we good to go? Please, they say reaction is free. The reaction button is not charging at all. Everything is very expensive in Nigeria except our Zoom reaction button. It's free. Just click on it. Click on it and express yourself. It's free. Okay. People are not smiling this evening. What's going on? Osato, are you at your desk? I'm only seeing your picture, but I'm not seeing any reaction. Okay, I want to believe that we are here and we're ready to go. Ladies and gentlemen, please help us welcome this wonderful person. I'm so, every time I have opportunity to introduce him or for him to talk, to listen to him, I'm always in awe. I'm honestly always in awe because this young man joined the movement, I think sometime in June. He's going to tell you exactly when, sometime in June. And between June and today, he has recorded way over 30 testimonials personally from people that he has touched personally. And that is beyond amazing. God is healing back, and he has made it a mandate to ensure that nobody will be sick or will suffer from any prolonged illness under his watch. And that is exactly what he's doing. And we're celebrating him today. Ladies and gentlemen, please, with an applause, can you help me welcome Don, Don Jeff. Don Jeff, are you in the room? Don Jeff, are you in the room? Please unmute yourself. Can I see the applause, please? Please go ahead and share this applause. It's not easy when we put this together and somebody comes from, speaks from his heart, and wants to share his experience with us. So Don Jeff, are you in the room? Network, please be nice to us today. Don Jeff.
Yeah, send me.
Are you arranging your Nigerian flag? Okay, please let's let's show some reaction. When
Isaiah heard the voice of the Lord, he only said, "Here I am, send me." So that's what I'm doing.
Thank you so much for joining us. Yeah, thank you for the applause. Thank you. Thank you so much for joining us. We started this last week when we were discussing, we are having testimonials being shared. And you started with the bomb last week. And we just knew that the time won't permit us to really totally enjoy what you wanted to serve us. And hence we moved it to today to have you share your testimonies with us. First and foremost, okay, I didn't even introduce myself. I'm sorry, my name is Mary Tinoye, aka Didi. And of course, I'm your host for tonight. Okay, so Don Jeff, let's get to meet you. Some people were not here last week, so we're going to take it from the beginning for the benefit of those that didn't hear your story last week, how you started, what got you started, and where you are today. So the floor is entirely yours.
All right. Thank you for giving me the floor. In case you don't hear me, please quickly wink me because I don't understand the network this evening. But if I'm breaking, also let me know. Good evening, everybody. My name is Jeffrey Egbadon. But let me introduce myself very well. My name is Dr. Jeffrey Egbadon, not a doctor in medical field, a doctor of science. So I'm happy to be here. I was here last week, and then the fire was burning, and then one fire extinguisher just came and quenched it and said, "Put down, guy." So today we are here to continue what we started. I actually joined this business in June.
Volume, please. Volume.
Okay, you need to step up your volume and you need to reduce. I think the children are there having their own field day.
Okay, 1 minute.
So, okay.
Okay, sorry about that noise you heard from the background. I was trying to entertain two people at the same time. Um, all right, I actually joined this business in June, precisely the second to third week of June. That's when I joined, and before then, I was just an ordinary user. I signed into the saver package for me to use because I had a medical challenge that led to this. Unfortunately, today I'm not with the system where I can bring out that picture because the lockdown sent me out of the office so urgently, so promptly, and because of the crowd also, I felt the need not to come out of the system because I was attacked yesterday because of this. So I left the system just to
Wow.
safeguard it. Yeah. So I had a medical issue that had to do with my stomach enlargement, and then they burst a cut in my intestines. This sent me to an emergency surgery. I'll be brief with that because I've said before. And in the course of it, unfortunately, I was pronounced dead. But I haven't stayed for in a particular spot where I was kept for like 5 hours, and there was time to transfer me to where they had to keep those kind of people that were sleeping and never wake up. God brought life into me. So in the course of that, I started receiving treatment in the ward, and the enlargement was so big. The stomach was very large. I mean, just keep yourself in a position like you're sitting now, and your stomach is touching your knee. That was what I was at that time. I was bedridden for over 90 days, sleeping on my back, not turning to any of the sides. If you turn me to any of the sides, it's like you want to kill me that moment because the whole weight of the stomach would just fall to one side. I think it can even pull me down. So because of that, I was kept to sleep on my back for the whole of that 90 days. The enlargement was so heavy, and I continued to receive treatment until after 90 days, I was allowed to go home. Then I was able to probably move a little, but still in my house, I was still sleeping with my back. Then somewhere along the line again, I started getting better, but in a slower pace. Then the enlargement will not go down. So it was even possible for me then to fold my hands this way, turn it this way, put it inside my stomach, and it will get into my wrist. So there weren't any tissue holding my hand, so it would just go in straight, like putting your hands inside your pocket. So I went back to the hospital to see the surgeon, and there and then I was told that they need to do another a correction surgery such that they would see a way to bring these tissues together because at the middle of the stomach was just empty, just like a hole. So that surgery was done on the 20th of April this year during the lockdown. And so I went back for it and it was done. I stayed in the hospital for 5-7 days. And when I came out that same month, the same situation was just there. There was no reduction. I was just with that wound, but I could still feel the emptiness. So I went back again to the same hospital, and I was told to live with it. That there's nothing anybody can do. As at that time, so for me, it was just a turning point. There was nothing to do anymore. So I started putting on big clothes. I was big, in fact, I was large too. So because of that, um, I was fortunate to have met this product through my upline, Soft Mind, patient in Mavoy. And she gave me just a packet, half a packet of double stem cell and 3 Snuffy for. But I was reluctant to take it, like I said last week. I thought I was not going to take it because I've tried so many. Actually, before now, I've dealt with the GNLDs, I've dealt with some other ones. I don't want to mention them anymore, just like that, some supplement like that. So there wasn't any result. So for this, if anybody's giving me anything now, I don't know how that person will convince me. But because for the fact that she's my childhood friend and she left it with me, she left those quantities with me. I took them home. I dropped them. But on the second thought, I thought of the fact that after all, it was free. So there's no need to complain. I can take any free thing. That was how I started taking it. So that the 3 Snuffy was for 3 days, as well as this a double stem cell was for 7 days because it was just 1 a day. That's what I was doing then. But I just observed this change in my system. I started feeling the reduction one, the weight of the tummy started disappearing. Then because there was something that was wrong with me then. If I go to the toilet to stool, I will need to be patient. I just need to sit there and wait for it to come out. There's no pressure to put on the stomach. There's no way I could force it. So it's just like a twisted tummy and so it's twisted intestine. So I just need to do for it to come out. So I say that way, but now what I observed was that with what she gave me then, I was able to just pass out through without any complaint. I'll be able to pass. I was able to pass out urine too without too much stress, no difficulties. So because of that, I quickly took the silver package from her, and I started taking. So the silver package actually did the magic, not magic, the miracle. Sorry. Everything went down, and then the tissues that we're talking about all came back. So my stomach became a solid. It's called a solid block. Like as I speak with you today, I could press any part of my stomach. So stiff, so solid. The pains disappear. All inflammation disappeared at the same time. So with that, having gotten that kind of a speedy recovery, I now asked to know the product the best, not the more. So having known the product, I now said, okay, there's need for me to actually go down to the grassroots, look for people who are suffering from one element or the other, and begin to do the same thing. Because for me, it was a favor to have met this person, and it's a favor also to have gotten this therapy. And so I see that way that I should do the same to the grassroots. That was how I took it and started giving it out. I started giving this product out. So, like I said last week, today I'm fine. I shared my pictures. If you see my picture, you understand that today I'm fine. Even the poster we use in this meeting, I mean, if you look at that poster, you never believe that this man once had a tummy like that. It wasn't like that before now. You could see, you will see my belts if need be. And my sides were so heavy. But today, if you look at the poster of this meeting, you understand that everything has drastically gone back to zero and I'm enjoying my health. So I took it out and I started giving out to people. As you have heard, today I've recorded 40 testimonies in total, and I'm sure by November, I'm sure by November I'll get to 70. That's my target anyway. I really want people to know this. So, notable among my testimonies, I would like to share a few. The first one I
Okay,
had.
just before you go there, for benefit of those, I know you just kind of gave a summary of your incident. You know, for benefit of those that haven't heard this, because when you give the summary, it's under the assumption that everybody has heard, everybody knows that story. But we have new people in the house that have never heard this before. So let's just quickly highlight what the problem was exactly. You know, what was your challenge? I know it will have to do with your stomach, but what exactly went wrong with you, and how did this product play a role in helping you get that fixed? You know, just briefly, what exactly was the problem, and how
Okay,
did this help you get that fixed?
the story is like this. Before we discover what happened is this. I went to a gym one day. I have a gym class, an aerobic class where I handle about 50 persons. So I came back from gym one Saturday, and that same Saturday I was sitting in my sitting room here, and I felt the need for my kids to also do what I've gone to do. I was even making jest of them that they are putting on more weight. There's need for them to do exercise. And while I was sitting, I just stood up and I had this kind of cramp inside, I mean, on my knees. I sat down. Before I got up again, I had the same cramp on my waist. That's how I lay down and nothing was happening. But just as I kept my back on this city, it was difficult for me to stand up. I just started seeing the rise just coming up like that. So that was how I was rushed to the hospital. And then I was taken for CT scan. And CT scan for about 12 days, I was in the hospital eating through cannula, no more eat, no more talking. And then when I was taken to CT scan, there and then, um, I was kept on a wheelchair. Then, like I said, the stomach was enlarged, and it was during this course of the scan that it was discovered that two of my intestines have actually cut. Um, in fact, when I then I was because I was not talking, I could only answer questions. Is that I give you a nod for a yes, or I give you a nod for a no. So that was how the situation was, and the doctor in CT scan, that is a Afrihub Ikeja, the way he ran to me when he saw when the result came out was one of the reasons why I know there was a problem, because he ran to me and said, um, "Are you Jeffrey Egbadon?" I said, I just nodded for him, yes. He said, "You ever have ulcer?" I said no, because I know I never had one. And I said, "Wow, this is serious." So when he said it's serious, you could see the expression on my eyes, needing to know what the answer. I mean, what is so serious? And he now said something like, he told me there that it's serious because your from the report I got, your intestines have cut, and if this is not done before the next 8 hours, there's likelihood that you may not survive it. He said it openly. It's not a secret. So I was there with my wife, and then instantly I knew that there was a problem. So I was rushed I was taken from the through the ambulance. I mean, I was taking the ambulance back to the hospital. And so, can you hear me? It's like this network is breaking.
Yes, yes, yes. It's
Okay.
very clear.
Can
Okay.
hear
Thank you
you.
very much. All right. So we was taken back to the hospital with the ambulance, and because there was this traffic that hit Lagos that day, virtually every lane was blocked. But because God wanted me to leave, and the driver was able to squeeze the way out, that means that day he ran the bus through the railway, the wagon lane. I hope you know railway here in Ikeja, that lane. That was the first time I ever see that a vehicle could run on that lane, because he has to. By all means, he needs to get to the hospital, because the doctor told him that he needs to get to the hospital that very moment, and they need to be. They've already made their calls. They've made arrangement for the surgery, emergency surgery. And when we started running on that wagon lane, what I discovered was that I started throwing up, and I threw up a lot. I mean, the whole floor of that ambulance was filled with with what came out from my system. I can't tell you that it's just natural things that will come out from any system because I was not eating. But I think I feel it's so smelly. Maybe I would say it's part of the phases that were not coming out from my system that really actually came out from my mouth. Who can say? So that was how I was taken to that hospital before the surgery proper. So now, I will tell you something again. I was sedated in that surgery, and as God will have it, midway into the surgery, my eyes opened. I opened my eye to see everything that was happening. And I remember out of the about 8 doctors were there, or eight surgeons per se. One of them quickly grabbed the collar and said that he was shouting that they should sedate me. But the chief medical consultant said, no, nobody should sedate me, that it's possible if they do that, I may not come back again. So they just have to allow me to bear the pains. That was the day I knew that in our stomach we have 3 layers, because I saw how I was stitched. In fact, I saw how the checklist was done on me while I was crying. You know, you have to cry because the pains, my hands were stuck, my head was stuck, but I could see with my eyes. And I'll be hear something like, how is the liver? The liver is positioned properly. How is the heart? Is it situated? Yes. What about the diaphragm? Is it responding? Yes. So each time he's saying this, somebody is ticking the checklist, and then it's okay. Let's reline the intestines. I heard that with my own ears, and I saw how it happens. So this is the only man that God has made to see that kind of a situation. I would like to you. So I saw how they do the settings. Can you hear me? Can you hear me, Didi, please? I just want to be sure.
Yes, I'm hearing you. I'm just picturing how you were. Were you like seated up that you could see your stomach?
No, No, I was on the sleep in the slanting position. You were sleeping flat, but your head is a little bit higher. You could see directly everything that is going this way. So I could see what was happening. I saw, how you kill chicken. You know how you do it. I could see this. I could see this. So I was shouting. I was really, really shouting there. And seriously, I saw how everything happened. I saw the stitch from the first to the second, from the second to the third layers of my intestine. It was in that after the pain that I passed out, and that was how it ended. So the next time I remember, it's about when I woke up from that corner of the bedroom, just to see that I've already been just to keep somebody in a place that looks like a toilet with the walls, everything just separated, just to tell you that yes, this one is completely gone. And I heard when I woke up, I heard the whole gist. In fact, the picture I shared was the courage of my wife to take those 2 shots. She said because if the fact why she took it was in case anything happened. So somebody will not like if she's not there, that kind of a thing. She just quickly shook her hand and grabbed those 2. So that is how my situation was. For those who, unfortunately, because the system is not here, I'm just showing you that beautiful picture because it's part of what I'm going to use to write a book now. So it's just how it happened until that moment to which I was taken back into the world and then got myself back, and then the story of how the stem cell therapy has helped me. So the therapy they really did the job. That is why I could tell you that I've treated somebody with ulcer, because my own case too, an intestine that was cut and had to be stitched together. I mean, at the point even reduced to an extent, and then stitched on 2 sides. It shows you that someone that has ulcer is also kind of a wound. So if I tell you that I have a success in ulcer, it's because of that story, because I took something that really actually did the job when it comes to wound inside the stomach. So that's how my recovery started. And when this recovery ended, or let me use the word ended anyway, that's how I started doing this business today. So that's why I said I went down to the grassroots in the sense that I made sure this product gets to everybody that I've ever come across, or that somebody will recommend me to, that has a medical challenges, many medical challenges. Even in my own family, not like if I'm the only one that benefited from it. I had to share to other people. So as I talk, I'll be telling you either my family testimonies, or I'll be telling you the business testimony. When I say business testimony, I mean people that I've met outside this outside my own family. So before now, I was using glasses also. So it was in the course of using this product that I dropped the glasses. If you can see, for those that knew me when I joined the business, you will always see me on glasses. Even the picture that introduced me to PhytoScience was on glasses. But today it's no longer. I had 2 sets of glasses. I can also share my medical report, if I mean my eye report, if anybody cares to see. Um, so I was on glasses, and I was actually in a point where you hardly differentiate between images. That's how it was for me. And if I could see anything from a distance, it's like if it is covered with dew. Then if I need to read, I will need to bring that closer to my eyes just to have a view to read. So someone like my own kind, what I do is if I have to rush and read, I'll make mistakes. In the case whereby in most cases I will have to change certain alphabet to suit what I was reading. That's how the situation was for me. So I hardly do without the glasses. But fortunately for me, in the course of treating what brought me out of surgery, the eye own also got itself back. So I got recovered from the eye issue. So that is as regards to that. Then um, around 1995, precisely July 15, I was on my way to Mina from Abuja. And just when we got to a place in Suleja called Maje, there's this, then Julius Berger was doing the construction. So there's this big truck of Julius Berger that ran into a bus that contains 16 passengers, of which I am one of them. So out of everybody in that bus, I was the only survivor. So 15 of us died, or 15 of them died. I survived it, but that never left me with a scar. So I had this, my kneecap went to the side of my leg. So I mean, at the time I was also using crutches there, but somewhere along the line, it came back on its own. So when it came back on its own, so I used to have this constant pains on the knee. Meaning, if I squat down and stayed for too long, there will be this pain that will come on me. So this pain has been lived with me, so I'm used to it. It lived with me all through until when this surgery was done. But fortunately enough, uh, hello, hello.
You're still on. Yes,
Oh,
you're
because
on. You can keep
uh,
going.
my screen just changed, so I was wondering what happened. Okay, can I keep talking?
Yes, please. Go
Yes.
ahead.
All right. So there's this pain on my knee. It's always there. Each time I squat down to do anything, getting up, you must hear the cracking sound. It's just there. But when I started treating this, the issue that has to do with my stomach, that pain also went away with it. Today, as I speak with you, I don't know how the pain left me, but it left me even quickly faster than before I started using the glasses. So if I tell somebody I also have a success story on arthritis, it was still that pain that I used. What I got, how that one went away was what is helping me. So, by and large, I went through the society to try to see how I could give back this therapy to people. My first success story was my sister, my own younger sister, a mother of two, somewhere in Igondo here. She had asthma, and her asthma is the kind of inhaler she uses, the metered inhaler. So if she overshoots, it's a problem. If she undershoots it, it's a problem. So that's how her case was until I gave her the double stem cell as well as the crystal cell and Snowy 42 to start taking. And I gave her the same recommendation I was taking for myself. And she did it. And before you know it today, I don't know if she still know where they sell inhaler. So our inhaler used to come from the UK per se. But today, my sister is just my sister. If we were doing this presentation on a Saturday, she would have been here and I would have brought her to see it herself. So mainly it worked for her. We started going around giving people. So um, like I've said, I had a success story on. Okay, please. Okay.
Okay, the one of your sister, how long did it took for, I mean, how long did it take rather, for you guys to see the results that you're sharing today?
My sister took 6 weeks. It took her
Okay.
6 weeks, 6 solid weeks to get the result.
What
Even the
exactly
first,
did she,
come again.
what exactly did she take? What product did she take?
Okay, she took the Snowy Fort. She took Snowy Fort. She took double stem cell, and she took crystal cell. The
Okay,
Snowy
double
Fort was
step
taking this
cell and
as
Snowy
Snowy
Ford.
Fort. Yes,
And in
these are
six
the
weeks,
three
she
things
got
she took.
remarkable results.
Come again.
And in 6 weeks, she got remarkable results.
Yes, yes, yes.
Okay. All right, go ahead. Wanted to note that.
All right. So then, after her own case, I had a member of my church when I listened to what's her that Fatimi, one woman, the woman that said she fell with her spinal cord on the ground. Yes. So immediately I got the new wind of her own story. I actually went to her. I was marketing the husband because the husband has this protruded tummy. So I was telling him that our crystal cell could assist him. So because I kept talking to him and he's feeling reluctant, then when he started seeing people come to me, he now came to me and told me the story. He came in not, he didn't tell me that it was his wife, but he was saying it's a friend he wants to help. So, but at the end of the day, when we started administration and there's this body chemistry reaction, he has to come back to tell me that it's his wife. That's when I now spring to action and went there. So the problem is that what he told me before now was that if she if she was supposed to undergo surgery for the spinal cord and then was told that it's a 50-50 thing, it's either she does the surgery and works or she does the surgery and remains on the wheelchair. So that was how it came. And I told him that no, I've heard a success story of somebody that fell also, had this accident, that accident, and we did for her. I mean, this different did this XYZ for her. So with that, um, we quickly started administering the product. Now, for the first month of taking this product, actually she got some good sign, but she also got some heavy reactions per se. But we never gave up. We continued. By her 3rd month, before the middle of her 3rd month, the half of the 3rd month, she was okay. We went to do exercise together just to confirm it, and I was being celebrated. So it was from her that I got another person of a similar issue, which of course, Mommy Fatima, we can also tell you here that when she was getting reaction after resolving the spinal cord issue, that's the cervical vertebrae, the center, the bone close to the hips. After resolving that one, she started feeling pains probably on her chest, and then she had to come. That's why I myself, she and Fatima, Mother Fatima, we spoke just for her to share her own too, because she became this confused and like saying, this pain she's feeling on the chest. But actually what we did was not for your chest. We did something from your back. And now you are feeling on your chest. That to show you that there are other underlying facts. That's why we had to let her know. But today I think she's also getting better. She's also enjoying herself when it comes to that issue. So that kept me at 2 of such kind of a person. Then I had a friend of mine who is resident in Canada. The father had been bedridden for 3 solid years on an issue of stroke, just as you can see from my background wall. He had stroke for 3 years. He has been bedridden and he was kept in a nursing home in Ibadan. So that is because the fact is that because he is in Canada, the siblings are also working. They are no longer available. So they kept the father there. And when he told me, and when I started talking with him, he was like, "Are you sure this will work?" I know we had a stroke testimony here. And so I told him, yes, it will work. I sent him that testimony of the man that said he spent about 22 million trying to resolve stroke. So immediately he saw it, he keyed into this business, into the product use. And I sent him the same therapy for, like I said, I told him it's within 3 to 6 months. But fortunately enough, or by the grace of God, just within the ending of the 1st month into the 2nd month, the father started working. The father that was not talking, called him on phone. They had a video call. And he saw the father working. So he called me quickly and said, "No, give my father another dose just for him to maintain what we have gotten." So today, as I speak with you, the father is talking, walking, and doing he's back to his life, and the limbs that were not functioning are now functioning. Then from that family alone, I got another family here in Lagos as well, whose their mother had been on stroke, had been bedridden for 2 years in the same issue of stroke as well, and the same medication was given, and the mother is today working perfectly well. Now, the 3rd person on stroke I had was an ischemic stroke, where you can see from this background where there's a bustage on the skull, on the artery in the skull or on the brain, and that person has a collapse. One side, the right side of his body was completely gone. He was just hanging, so he couldn't move. And then and there, we said, okay, this one is a different case. So we tried different procedure just to see. It's all about trying. That's like what you see here in this humoral stroke, where this one you see on this side, he has a bust like this because it completely killed one part of his body. And if you look at him, you think he has palsy because the jaw was collapsed as well. But when we started as ministering, we did our first 3 months. He's getting better as at that time. So we need to do more. So we delved into the 4th month, and at the 4th month, the man recovered. So that's how I was able to get 3 stroke cases. So if you ever say I had success on 3 stroke cases, that is one. Then an uncle of mine also, who stays somewhere in Muwe, he has gone to India for spinal cord surgery, and haven't done that surgery. He was still not working properly. We need to use some gadgets to keep him straight. And this is what he was actually managing all through until one day he went, I don't know how, somehow he got electrocuted. And you know what high tension is. That slammed him on the ground. And that kept him for 6 months. Actually, he was not aware until I was called that he's on the ground bedridden. They just kept him on the playground, By the time I got there, we tried lifting him up. We discovered that his skin was stuck to the ground. I think there was tears. So we just have to. Why I was called was because as of that day, if you remember, he has his PP was already on 200, 170 or so, or 200, 175 within this range. So quickly, as I heard that they just told me of the BP, and I quickly run there with my Snowfie. I gave them the Snowfie, promising to come back to my own place where I stay at Ikpaja to get the required dose. and to take back to him. So I just asked them to take the Snuffy all through that night and let's see. So rather than I just gamble it anyway, just to be sincere, I asked him to take 2 Snuffy that day, that evening. It was a Wednesday in the evening, and then first thing in the morning he take 1. Let's see how he reacts. But by and large, we're so lucky that by the morning time, his BP dropped from 120, his BP dropped from 200 to 120/80. That's a normal BP. So because of that, I had to hold on for some time. I didn't give him the medication again. I wanted to see if at all there will be any change. We stayed for 3 days. He was still maintaining 120/80. So I gave him the other doses. So even he too, the limbs that he could not use, now he's using them. 2 weeks ago, I think he went for Thanksgiving in Living Faith Church to tell you the kind of breakthrough he had. Somebody that was on the ground and now has gone to walk with his own leg to the church. The only thing I know now is that he's still trying to get the normal grip of moving full profile, I mean, with strength. And I told him not to worry because I know with time he will move the way I should move, because I also learned how to stand. I learned how to stand. I learned how to sit. I learned how to walk. And I learned how to walk, run after my surgery. So I believe that's part of the healing process he need to get. So today he's still walking, but I think on a slower pace. Then with the course of this, I had a classmate of mine in the course of advertising this product. Like I said, a classmate of mine came to me, called me and said he has a patient who has sickle cell anemia in Uganda. So, and I told him this product can work because I felt since it's all about cell rejuvenation, there's possibility of changing the paradigm. So if this can work for over 200 chronic illness, and I saw sickle cell anemia as one of it because I read it properly. So I decided to give them dosage. Today, as I speak with you, this boy is now okay. He used to have green eyes, he's now white. He used to have swollen limbs, he's now down. He plays with the mother. He's doing very, very well. And I must announce to you here today that his genotype is AA. So, yeah,
Whoa.
that's it. So with this, I was also introduced to another case of a sickle cell anemia person, whom I'm also handling now. I'm waiting for his own result. It has not come to me, but he is okay physically. He plays football now. He does everything he has to do like a normal child. So I've asked them to give me his next test. We know the test before. I will know how he used to feel. He passed out. This is a child that will just pass out, even talking to you, according to what the mother told me. But today he's doing everything like a normal child. So we're waiting for that result. So you could see that the more you get these people, the more you transform their life as the way God has transformed mine, they will see bring people to you. Like that was what I was telling people. I was telling people that most of the people I just sit in my house and they bring them, and that is it. Now, I have somebody also who had cancer of the skin. If you see his skin, you understand what I'm saying. Probably maybe over time before now he has bleached his skin, and then somewhere somehow the veins are green, and before you know, one thing led to another. He had a cut, and that cut led to one thing led to another. Before you know it, that's the end of the story. This guy is on one spot, and he was even decaying. That's the way I'll put it. His skin was even coming off like that. So when I saw him, I still told him the same thing. I said, if the Lord could do it for me, he can also do it for you. The only thing is for you to have the courage to take this therapy, because this therapy does a lot. And today, as I speak with you, is also another part of my testimony. It's okay. Those rashes on the skin disappeared. And in fact, the one that would have led to some kind of nature, this kind of scars like that, I just on my own gave him our medical intensives, and those ones are no longer there. So that is also another breakthrough for this product. Now, in the course of doing this, I was introduced to somebody that has an issue with the pelvics. That's an issue with the pelvics. I think our own issue is that there's this pain on the pelvic bone, the pelvic girdle, so that bone, the joint there, and that made her to stay on one side. So with that, she couldn't sit properly. And if she was, it's obvious that you will know that this person is in pain. So we asked for the X-ray, and from the X-ray, it was shown that the ball joint, the bone, that part of the bone that looks like ball is already wearing off. There's a crack on it. So, and I told her, don't worry, that you get this just the time. And I made that to understand also that it just depends on our body chemistry. It's lucky, it will be like others, but if not, let her continue to take. As I speak with you, I was in the Thanksgiving of this woman after 2 months. We did a Thanksgiving because she was left with no pains, and that left her completely. Now, while we're talking about this pelvic issue, and she quickly brought to me what I want to talk about today. Today, I have 3 fibroid stories, success stories. She was the one that brought me the first lady with fibroids of over 10.6, another one 5.8 or something like that. I remember because I saw the result. So when we were administering to that woman with fibroid, I told her that it will work for her because I've watched the stockings either Zimbabwe or so. When if I went to her wall and I saw how she had success stories with the crystal cell on fibroid, so quickly I told this lady that this woman that she's also going to experience the same story. But in my own case, I felt the need to make her start with our normal crystals, Sophie fought as well as the double stem cell, then that crystal cell must be done taken in the night. The reason why I always say people take crystal cell in the night is because when you're talking about healing wounds in your system, there's need to do that most best when you're sleeping. You know, when you're sleeping, the body is at a relaxed mood. So anything that wants to do with it, which can just happen. When you wake up in the morning, you don't know what happened at night. And we did that for her. One day she was to go to the church. On a Sunday, she said she wanted to go to church, and she felt the need like she wants to pass out urine and came back to the house to her toilet to do that. While she entered the toilet to do that, she just gave this thing out. Like 3 balls came out from her system, 3 big balls of what you expect to know as fibroid. And I quickly, when I was called, I rushed there, but I wanted, she didn't allow me to take the picture. And when I asked her for the picture, then she said there was no picture. I said, why? She said, no, she doesn't want anybody to see what is private. I said, okay, no problem. But the mother, whom she sent the picture to, showed me the picture, though refused to give me a picture. But the fact is that she had already gotten the result she wanted. But after that day, though, she continues to bleed, and she ran to me again and like, wow, the bleeding will not stop. And I told her that no, what this does is a cleaning process. It must clean everything before it stops. So you don't have any problem. Don't worry. In as much as you are taking it out, it will definitely stop. And I think that same week, I gave her just a packet of crystal cell because I was just calculating that 2 weeks is enough for her. But within 7 days, the bleeding stopped completely. Now, when she got better, she now brought for me another woman also of the same issue of fibroid. But this her case was that the fibroid was mixed with tumor. She was just bleeding continuously. They had to take her to, they give her blood. Every week, they must at least give her certain amount of blood in the hospital. So she became this week and pale. She doesn't go anywhere. She's always at home. She needs help to do everything she needs to do. Then when they brought her to, the family wanted me to confirm and and assure them that she will get. That's another part of the risk in this business. When you want to administer to somebody and the person wants you to give him a double assurance. So I gave them money back guarantee. That's the assurance I could give to her that she will get better and she getting this money back guarantee if need be. Because they were like, they wanted to take her for surgery. And I was trying to convince them not to. So you know what it means. So, but I said, if it is your money, I can give you back your money. Aside that one, there's no other guarantee I will give. So with that, we started. And seriously, within a month, the bleeding stopped, fibroid came off. She also does her thing today as I speak with you unaided. She doesn't need anybody to aid her anymore. She does her chores. I went there. This is not this. I'm telling you a life testimony. Anything I tell you is my own recorded testimony. I'm not telling you somebody else's testimony. She does her things herself. Today, in fact, she is trying to become an ambassador of this product as I speak with you. Even through her, I'm selling this product to other people. That's the level of how this product could do for somebody. Now, she also brought the 3rd fibroid case that I have. And that one also, that one has left the system as well. Though it wasn't big, but it was an issue to her. That has gone. So that we have 3 fibroid that left that system. Now, the 3rd person with this fibroid that brought me her friend who stays in Obalende, who had been married for 8 years without any success. So when the lady came and we had to talk, something prompted me to ask her if she has treated any infection before. in the past, and she accepted. She deemed it fit to tell me yes that she has actually done something like that. So our case was one. There's an issue of infertility. There's an issue of hormonal imbalance in our own case. Then when we're talking, something else, I just still felt the need to ask about the husband. So when I asked about the husband, she said she could not speak. She could not speak much of the husband, but that she will connect me to him. So I spoke with him, and I said, man, I talked with him, and is anybody hearing me? Let me just be sure. Okay, thank you. Yeah, you can hear me, right?
Yes.
Okay, thank you. So she connected me to her husband, and we talked. And the man told me his issue was an issue of low sperm count, as he was told. Then I asked him also if he had treated any infection. He told me the numbers of infections he has treated. So with that, I now said, okay, there's need for us to double what we are going to do and see how the result will come to be. I'm just waiting for the final result, which is for her to get delivered of a baby, because today, as I speak with you, she's pregnant. That is a success story.
Wow.
Yeah. It's in Obalende. That's in
Don't
Obalende.
hold. You are loaded. Hold, because I want you to be able to give something away. And I know that people have questions to ask you. So
All
I don't
right.
want you to get to the point where it will be too late for us to take questions, because the reason we are here is to help people. The reason we're here is to help people, and I know I see already
Yeah.
people are already asking questions in the chat room. So I really want us to see how we can break this down, at least for every single person that is here today, that needs to be thoroughly clarified on how exactly they can use the product, how it has helped you. Because your testimonies are amazing. And the fact that you've been able to record this testimony in the shortest time possible is a gift. I will tell you that it's a blessing. Yes, we do know that the product works, you understand, but the speed in your hand is anointed. I must chip that in. So we would want you to help us. Yes, you have taken just about, I was listing them. I think you've gone to about 12 or 13 testimonies now. Some of them I put together. You've spoken about ulcer. We talked about ulcer. You have recorded testimony for ulcer, spinal cord injury, arthritis, stroke, high blood pressure, sickle cell. You even have a testimony about conversion from SS to AA, which is amazing. Most people don't believe this, so I know people will have questions for you. Okay. We talked about, I think, skin rashes, something that has to do with rashes on the skin,
That's cancer of the skin.
cancer of the skin. Okay, skin cancer. We talked about the pelvis. Then you talked about fibroid, and now fertility. In fact, this skin for now is okay.
Thank you.
Let us
Because I was confused.
It's
Okay.
amazing. It's amazing. And it's a real testimony. And the reason why you are so persuaded is because you are a testimony yourself.
Yeah.
You are a testimony yourself, and you started with yours. So I know people have questions. Let me see if we can open up. Let me not preempt their questions. Let me see if they can open up the room and let's allow people to ask questions. But before then, can you show us this product? You've been saying the product, the product, the product, the product, and a lot of people that are here, particularly those joining us for the first time, may not even know what products you are referring to and why these products are able to do this. So at this point, can you just briefly introduce the products to us and tell us how it works?
Okay. Can I just go inside and bring physically these products? If you don't
You
mind,
can do that.
just
You can do
spare
that.
me 1 minute, please.
Yeah. Well, if you have questions, you want to put them in the chat room, you can throw them down so that start listing them. And we're going to be asking our guest speaker this evening when he gets back. So do we have questions? Please throw them. Feel free to throw up your questions. We really want you to learn today. We really want you to go back with something. And there's no other, there's no best person right now to talk about this than John Jeff that has experienced multiple of these conditions. And he has helped people that have experienced same too. So I can see some questions in the room. Please feel free to write out your question. Go ahead and do that. And if you want to ask them, then you can raise your hand so that I can note you now and call you when your hand is raised. And Emmanuel Obasa, this hand you raised, was it the one you raised as the first time or you have a question? I have Emmanuel Olusunjo. If it's not, if you're not asking a question, please lower your hand. But if you want, if you're raising your hand to ask a question, then leave it. I have Emmanuel, I have Benson, and I have Blessing Gene. So I'll be noting three of you to ask a question as soon as John Jeff explains to us exactly how the product works. Okay, John Jeff.
Okay. Now,
Go ahead.
yeah. Can you hear me?
Yes, please.
Okay. Let me quickly do what I did before. As a place, I wrote some things down that are so critical to this product that I would have loved to say about, talk about. Okay. The 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 first product you see is a snow fort. Okay, sorry, I turned it upside down. This snow fort. Now, I always administer this in the morning. Why do I do that? Because the system needs to be free. Okay, meaning, can somebody hear me, or do I need to raise my mic again?
Yes, we hear you.
All right, the system needs to be free. One, two. In a case whereby your immunity is weak, probably the white blood cell is not functioning the way it should function and needs to be aided up or needs to be boosted back so that it can fight any infection in the system. The Snowflake fort is just perfect for that. Then a situation whereby the system is choked, you need to detoxify. There are some people, probably they have a lot of impurities in their system. I don't want to use the word faces now, using as faces as the only impurity. There are many things that could be in the system that can make somebody fall sick. So when you take the Snuffy fort, especially in the morning on empty stomach, it will give you that room to degas. It will give you that room to drop us to properly, use too properly. It will give the room for anything in your system, probably even the blood flow. Like we say, when we talk about the sickle cell anemia, it gives you an opportunity for this blood to circulate properly. That's the essence of the Snuffy fort. Then any gastrointestinal issue, that is anything in the stomach that will lead your system not to function properly, the Snuffy fort is just there for you. Then when we talk about blood sugar, you see, like I was talking, I was saying something. Some people have this this is a system whereby their FBS, that's fast blood sugar, is high. I'm not going to talk only about the people with diabetes, but I'm saying with even normal sense as you and I that are here, try to check your blood sugar level. You will discover that some people are maintaining above 100 as I speak with you. Some will be within 100. Some could be 90. Some could be 80. Just like that, take it that way. Now, if one is okay and is having this kind of blood sugar to a level whereby it's above 120, it calls for concern. So there's need to regulate that. So what this does for you too is to help you bring your blood sugar down to a point whereby you'll be safe. Like most doctors will tell you, don't allow it to go above 100. They always say they have gone to some for medical tests. Some of medical tests we've gone to for in our company, yearly medical checks. They always say it, that try not to allow your blood sugar level to go above 100. I'm sure it's a factor of safety. So with that, if you take this kind of a product as the Snuffy fort, you are sure it's going to help you do that. Now, in a case whereby we're talking about acid and alkalinic balance, that is acid and base balance, that is the acidity of your body as well as the salt level of your body, that it helps to strike a balance. And now we've been told we have a body pH of between, I think 0 and 14 or 1 to 14, where we're told that from 0 to 6, it makes the body acidic. So you see, if a body is acidic, you know what you're expecting. More of issues, more of problem in the stomach, and so on and so forth. Now, if your body is alkalinic, too much of salt, you know what it does to the body. So What this does is to help you strike a balance. And if, for me, if it doesn't strike you a balance, if you need any balance in your body between acid and base, or acid and alkaline, or acid and salt, it means you'll be trying to maintain yourself in a neutral level, which is 7. So that is just what I see. I will tell you that the Snowy Fort will help you to achieve perfectly well. Now, I spoke about a sickle cell anemia success. The first, because it aids in proper blood circulation and also help to it helps the amount of oxygen. You have to regulate the amount of oxygen in the blood. So if that is the case for this product, that means if you have a patient that has sickle cell anemia, this is the product I use. So anybody I handle, the first thing I do is to make sure that system is free. Now, my own system, the way I administer is the way I took and got healed. That's the same pattern I'm using to give to everybody. I take this every day in the morning, first thing. After this, then this Snowy Fort, 1 sachet on 50 cl water every morning before I do anything. Even if I had to go for exercise on a Saturday morning, if I had to go for jogging, I must have taken my Snowy Fort on an empty bottle of this nature. And then after that, I go for jogging. So the first thing first is this. Then in the course of the day, we take a lot of water, you pass out a lot of urine. At the first time when I started taking it, I was just passing out urine. Passing out urine was an issue for me when I was in the hospital. That's why I told you, if I go to toilet, I will have to be patient for either urine or feces to come out. But when I started taking this, it helped me solve my problem in the sense that the moment I get there, that very moment I discharge. So that's the function of the Snowy Fort. So anybody that had to administer this therapy to, I first of all give that person the Snowy Fort. The next I give to them is the double stem cell. And the way I did mine, I used to take my double stem cell 20 minutes after my Snowy Fort. That's when I take my double stem cell. Now, if I administer to anybody, I just assume that person has the kind of body chemistry I have, and I will tell the person, please take this 20 minutes after. Now, why do we take the double stem cell? He said, every mental function, it is perfect for every mental function. Now, when we talk about mental, anything that has to do with the brain. Now, if you look at my background, you see things like you can see the issue of this stroke. You could see how arteries and veins go in and out of the human brain. So now, if this, I just believe when you take this product, if there's anything, even in the issue of maybe you're this kind of a person that will stay and start forgetting things. You're this kind of person that probably because of one reason or the other, because it's a cell rejuvenating therapy. The double stem cell had a tendency of bringing yourself back to what it used to be. So it will help you rebuild the cell system. And in the course of rebuilding the cell system, it also aids in displacing the ailing cells. That is how the healing takes place. So because I'm building in more cells in my system, I'm also sending away cells that are ailing, that are weak, that are not supposed to be there. Probably those are the reasons why I'm falling sick, or that's the reason why I fell sick. So this one helps to do something like that, to help you increase that displacement reaction. Now, when we talk about displacement reaction, we're talking about cell that builds through and divide itself through a process we call mitosis. Mitosis meaning that it is dividing into other daughter cells. So that means if there's a cell that is related to my brain that is making me not to function well, a cell that is related to my brain that is making me not to think or not to remember things, this product is perfect for that. So when you take this, the reaction takes place, the displacement reaction takes place, new cells are built, the ailing cells are given off the system. So with that, the double stem cell can do that for me. Then also, just like the Snowy Fort, it also helps to boost my immune system. So rather than fall sick unnecessarily, it helps me to increase the capacity as well as the functions of my white blood cell to aid in fighting that. So when I'm immune to a particular illness, there's no need for that illness to bring me down. So that is one thing again, it boosts the immune system. Then it's also something that is very good when you have a urinary tract issue. So a situation whereby, like you see, when I said I administer to somebody who is having low sperm count, probably he has an issue already in the system. Maybe the urethra is blocked, or probably there's narrowness in the gap of the urethra. Like for example, a person that has what do you call this, prostate. I had a success case of prostate too. So when there's prostate enlargement, what it does is to push the urethra close to the bladder. So there's narrowness in the gap for which this urethra can perform. So if you want to pass out urine, you know that is from the testes into the urethra is discharge of urine. I mean, from the bladder into the urethra is a discharge of urine. And from the testes into the same urethra is the discharge of spermatozoa. So if it is blocked and if it is narrowed, that means there's tendency that if one wants to pass out urine, it must also fit in. So then you can see that one of its function is that it helps in urinary tract correctiveness. So that means it helps you to it aids it. So that means if somebody has prostate now, start taking this product, there's a tendency for it to reduce it back, to shrink it back. And what is happening is this: when it is shrinking, the urethra will have a chance to occupy the space it's meant to occupy. It's not be something that is, it's not like if that is pushing it against the bladder. So there's gap for you to do whatever you want to do. Now, even so, in that kind of a case, it can also abuse the sex hormone, which is related to the gonad, and that's what the discharge of spermatozoa will be high. Like this guy I'm talking about now, I said, who we are expecting his success story probably after 9, when it's become the 9th month. It's part of it because his semen became more, the quantity increased. So, and by the grace of God, today there's a success story to that. So that is one thing the double stem cell could also do. Now, double stem cell, like crystal cell, because both of them work hand in hand, they are almost the same. In terms of vision, it helps you to preserve your vision. So I have told us here that I was on glasses before now, even 2 glasses, but today I use none of them. So it's part of it. My vision was restored. That's what it means. I could see brightly, I could see clearly, I could read. My issue before was that I need these glasses to read even something like the Bible. But today I can read my Bible even without the glasses. So you can see the reverser in my eyes, in the correction of my eyes. Now I have a glaucoma success as well. It's in the course of using this DS. While we're treating somebody that has a pelvic issue, the mother also had glaucoma, a very big one. And she said what they use is that they have this eye drop that costs about 7,000 naira, and they discharge that for a week just to reduce the pressure in the eyes. But when she started taking this product, it was reverser. The mother I don't think she took up to 3 packets before the mother became an ambassador of this product. She collected it, she stays in Ikorodu. Before she left, she came, took enough, and went back to that kind of place. So you can see in the case of the vision, it helps to do that. So that's another thing with the double stem cell. Now the double stem cell is just like the crystal cell. So they have I don't have crystal cell here. I finished. If each time I have just 1 packet, I'll be the one to consume it myself. I don't give it out. So I've used that. I would have shown us the packet. I'm sure somebody will display that. But the crystal cell is just like the double stem cell, and they both do the same function. But one thing about the crystal cell is that there's a special specific of tomato that was added to it just to increase the effectiveness. And also, if you look at by the feelings of the crystal cell, I think crystal cell is more lighter and more powdery than the double stem cell, but they all do the same activity. But the crystal cell is one thing I like about it more is that it is one of the best healing factor when it has to do with wound, especially internal wounds. So, like I told us of a success story of ulcer, the crystal cell is what I really targeted. Now, anything that has to do with wound in the system. So, I always apply the crystal cell. Recommend the crystal cell for any patient of mine. So, even if I have to give it double stem cell, I will still give it the crystal cell because I always say one thing: we always see the external, we don't see the internal. So it is best when you're treating the external. I just use assumption on the internal. Can somebody hear me? Okay.
Yes, we can hear you.
Okay, good. So you can see a display of the picture of the crystal cell. So they work hand in hand, just like the double stem cell, but it has a special species of tomato. So you can see even by the side of the packet, you could see what they put there. Is that just the stem cell of this tomato was used to make it more perfect, and it's also perfect for the eyes. Just assume you pick a tomato, you pick one tomato, cut it into half. Look at the sound of that, the way it looks. It looks like the pupil of our eyes. Just the way the retina is positioned, that's how it is even in tomato. So you could just imagine why it is very perfect in terms of the eye. But the double stem cell also do that because of more of it. But the fact is this: I don't give out double stem cell to a patient without giving that person the crystal cell. One must always give the hit target for you. So that is how it does. Also, it also aids in digestion. That's one good thing about the product, the crystal cell. So if somebody tells me, in fact, one of the One of my success line, the first success line I ever had, a platinum member. I'm pretty sure when she came here, she was not breathing down. That's her issue. She was not breathing down, and she said she find it difficult to digest, to eat. When she eats, it's difficult for her food to digest perfectly. So what I just did, the first day I was talking to her, I just gave her a packet and said, go and take. She never took even half the packet before she told me that she could sleep properly, and also her digestion rate has increased. So that's how she came into like, okay, yes, because of this kind of success, I'm going to key into this product. And that's how it is. So digestion wise, if you talk about the double stem cell, you are just perfect. I'm saying this because even myself, or if I eat anything now that I don't feel goes well with my system, I will just take a packet down, irrespective of the time. I don't have time for that. I'll just open it up and take. And before you know it, that's it. Even to sleep, if you don't sleep, believe me honestly, if you find it difficult to sleep, all you need to do is just take the double stem cell and you see what will happen to you. I've tried it. I tried an experiment. I just sat like this on my own and I took four sachets straight. That day it was difficult for me to sleep. And immediately I took it, I didn't last up to 2 minutes. I just only put off the light. That's the last thing I remember, and I slept off. And I woke up perfectly well in the morning. So that's another thing about the double stem cell. If you find it difficult to sleep, that is your product for you. So that's for the double stem cell. Then I told us of the cancer case. I told of the skin cancer. And you could see this miracle intense SS. This gave me the success result to that. I've been giving the patient or the person the double stem cell as well as crystal cell in case of anything internal. We're also applying this on the external, and we got the needed results. These are the products that I have here that I've been using so far to really handle the issue. Then if you want to talk about the miracle intense essence, that is for somebody that has anything that has to do with skin and wants to look glowing. I use that. If you see my appearance now, you understand what I'm saying. If my son has not slept, I would have brought him here. So you see how we look. So one thing that will make you use when they say something has an anti-aging factor or principle, that is when you talk about the miracle intense essence and the H2O moisturizers. So the more you use, the more you look glowing, the more your skin come back to normal. Before now, if you look at my knuckles, you will see that they were all black, but today it has come back. Not like if it bleaches anybody. I'm still a dark person, but I have this youthful look as of today. So that's about the products that I use, and this is how they work for me. Didi, any question?
Oh, I was dropped to 92.
Hello, Didi. Is it there?
Okay, can you hear me?
Yes, we can.
Okay, network is not being friendly at all here. I'm connected to like 2 or 3 devices and I'm having the same challenge on almost all of them. Okay, so we've gone through the products. Anka, are you there? Anka? Which of my co-hosts is there, please? Because I need to reconnect. My network is unsteady.
I'm here.
Which of my co-hosts so that you can help me start taking questions? Okay, they're not responding to me. I don't know if they're there. Don Jeff, if you can see the chat room. Can you see the chat room?
Yes, I can.
Okay, so can you help me scroll and
okay, let me answer somebody. Somebody's name is Simple. He talked about what about the treatment of pie. That's my number 40. Yeah, yes. Yes, I actually administer the same double stem cell and crystal cell and Snowy for pie. That's my success story. I mean, my success for number 40. The patient was bleeding, and when he stood, the pie will come out. That's the uterus will come out to cover what do you call the phases. As in, he needs to stand up and shake it out for it to drop. That's the level it was. The guy continues to bleed, and I told him that he could get the result with this. Seriously, his own case, I didn't even waste time. I just gave him just 1 packet of double stem cell and 1 packet of crystal cell with the Snowy fort. Believe me, he has not gone 2 weeks before he stopped. It didn't take that 2 weeks for him. He stopped. That's a success story. That's for the pile issue. Now let me see somebody again. I've told us of glaucoma. I have somebody in my team also who had used the same product for cataract. Like I said, when you're talking about issues of the eye, anything inflammation of the eye, just make sure you have the crystal cell, double stem cell. These two things are key. But like we said always, it is best always to detoxify every system. Okay, it is best to detoxify every system, so that you don't just say, because in the course of treating one, and that thing may come up. So it's best to just detoxify the system. Any other question on this line?
Don Jeff,
Yes,
there's a
sir.
question here for me.
Okay,
What
sir.
is the best?
You're breaking, sir.
What is the best product for cholesterol? Me.
Yeah. For cholesterol, let me. This is your key factor if you want to drop that. If you really need to read that, I think that I have a situation. Like part of my issue too was cholesterol. I really use this to detox. I have a video for cholesterol. I don't know if I can lay my hand on it now. I would have said, okay, let me just play it on my background so that you see. Let me see if I can see it. So that the snuffy forts is your best, because even those that wants to burn their weight, that need to drop their weight, they go on it. Okay, I used to be bigger than this before. Now I used to be really, really, really big, even with the issue that I faced. But today, even on your screen, you could tell how my reduction had been. So if you want to drop your cholesterol level, because cholesterol does not require me that somebody must be fat. It's just a cleansing. So if you want to do that, this is good for you, because the more, if it gets to the liver, that's when the problem starts. So it's best to use this so that it will assist the liver to do its filtration perfectly well. So even if you are going to take the snowy fort, still I would say add double stem cell to it, because you also need to rejuvenate your cell. You need to build the cells as well. So it's best to use the double stem cell as well as the snowy fort, or the snowy fort first before the double stem cell. So that is one of it. Let me see if there's another question on this.
About frequent urination at night. Same person. Can you hear me, Don Jeff?
Yes, I can. I'm even answering. So you see, if we're talking about frequent urination, what it simply means what it simply means is either the bladder gets filled on time, probably as a result of taking fluid, or else if there's I don't pray so. If there's any puncture on the bladder, if there's a rupture on the bladder, I don't pray anything like that happens. But you see, one thing about the double stem cell is so perfect for the crystal cell is so perfect for any healings. Okay, I'm sure if that person takes the double stem cell and crystal cell, it will get better. Now, we would have said, okay, if we don't take this in the night. I did an experiment on my own body just to see, because somebody said whenever he takes this, he urinates at night. So one day I decided to take it at night too. And really that day I passed out a lot of urine. That night I was just waking up. I said, okay, fine. It's not best to take the snuffy fort at night, except if you say you just want to titrate. But for that kind of a person, he will not take the snuffy in the night. But the crystal cell is good, as well as the double stem cell. Now, in the case of the second situation I mentioned, if in case there's anything like maybe a bruise or a wound on the bladder, because some people they tend to, like men, we keep urine far longer than women, so that kind of things may not be even good for the bladder. If the bladder becomes weak, definitely secretion will be high. So it's best to build the cell around the bladder. So the crystal cell as well as the double stem cell will be the best product for that person.
Here's another question, please.
Yeah,
Okay.
Eye defect, prostate.
Okay. Okay, so I see someone is asking a question on the components of the product. Now we must establish here that what we are offering in this product is a stem cell. And having the understanding of stem cell is regenerative therapy. He did mention it. So the alternative, the stem cell alternative that we are using here is the plant stem cell from sweet apple, burgundy grapes, and tomato. So the first product that Jeff explained, let me see if I can scroll there. Can you see my screen?
Yeah.
Yes.
Let me just yeah. Okay, so these are all the products. And Jeff already explained them, and he showed you the physical product. These are all the products. You do have the double stem cell and crystal cell, which are the stem cell based products. Then you have snowfield and Actor Plus, which are the detox and the immune booster. Then you have the topical application, which is the triple stem cell for skin related issues. So for the double stem cell, these are the components. It has the stem cell of this renowned sweet apple, which has the ability to help the human stem cell regenerate by up to 80%. Now, when that happens to your body and you have abundant stem cells, they will not start batting other cells and helping you to repair the organ. And that is the reason why the same prescription or the same recommendation for every kind of health condition, because your entire body is the result of cells. You are a product of cells. Cells is the collection of cells that created your entire body as you see. So you have the sweet apple, the burgundy grape, stem cell of the burgundy grape, blueberry and acai berry extract. So that's the component of the double stem cell, purely fruit, and they're very safe and very effective. You can see the benefit of acai berry, reduce bad cholesterol, it's good for diabetes, it improves your immune system. It helps in weight loss, all these things that Dr. Jeff has mentioned. It's perfect for anti-aging effect, it increases sex drive, it boosts your energy, it's good for the brain, it promotes a healthy heart. And for blueberry, blueberry is also very good in managing blood pressure. It's good to protect your heart. It soothes inflammation. It's an antidepressant. It promotes digestion. It helps for urinary tract infection, which can be the result of the frequent urine for the person, or which can be out of phosphate disorder, phosphate enlargement, or could even be diabetes. It almost encourages frequent urination. Then it's also perfect for eye care, for weight loss. The broccoli grapes component there helps for your eyes. It helps against
Hello, Didi.
I guess she has come out.
Can anyone hear me? I'm using another system now.
Yeah.
Can you hear me then, Jeff?
Yes, I can.
Okay, I'm trying to come back on the other system. Okay. Okay, so can you hear me, please?
Yes, we can. Yeah.
Okay, Jeff, maybe you just have to carry on. My system is really misbehaving here.
Okay. Any other question? I saw one question on pin. I'm trying to locate that question again.
Okay, so just have to carry on with the questions, please. My system
All right.
is acting
All
up.
right.
Some people are actually raising their hand. I don't know.
I guess everybody can unmute.
Hello? Can you hear me, Donja?
Yes, I can. I can hear you. I can hear you.
Hello?
Yeah, Didi, we can hear you.
I'm not getting any feedback. Hello, can you hear me?
Yes, we can hear you.
Uh-huh. Okay.
Okay, somebody asked, Agbola Sunday asked a question. Yes, we can hear you.
Okay, Nigeria, we hear you. I don't know what's going on. I have 3 systems connected and everything is just going haywire.
We can hear you, but you're from afar. You're far from the system also. But I can hear you still.
I'm just trying to help our first timers understand what the components of the product are. Okay, so can you see this?
No.
Probably we should add the people that are raising their hand.
Okay, now let's take questions.
Okay, so this is not working. Let's carry on with the question so that I don't keep you guys. It keeps going off and on.
All right.
So carry on with the questions, please.
All right. Somebody asked about pains. I lost that question again. I don't know if anybody can, any of the hosts can see it. If anybody can see, there's a question about pains.
That have raised their hands for a while now. We have Emmanuel. Olusunjo Basam, unmute yourself.
Okay, I have.
Okay, ask a question.
Yes, I have a question. Hello,
right.
Are you hearing me?
Yes,
are you hearing me?
Yes, sir.
Okay, good. I've just I've just undergone a cervical surgery.
All right, sir.
And I cannot walk well because I'm told that my lumbar has some difference, but I cannot do it. I'm just managing with physio and some drugs. What product can I use to help this?
Okay, Didi, you want to answer or I should answer?
Go ahead, Donja. Go ahead.
All right. Okay. All right. Good evening, Mr. Emmanuel.
Yes,
yeah. Yes, sir. Are you coming here for the first time, or somebody, or you're already in the system?
For the first time.
Okay.
No, I've been with you. I've been listening to your.
All right. All right. Because your system, the lumbar vertebra now is like any other vertebra issue that we have handled. So you will need to take the basic 3. I call them the basic 3. The basic 3 products you need to take, because as it is now, you need to build the calcium in the vertebrae and also add vitamin K to the system, and that you can get from the snow fort. Then you also need the crystal cell in case snow fort. That's. Can you see this?
Okay.
Yes.
It's not showing.
It's not showing. Probably because of my background. Maybe because of my background. It's my background that's causing it. Let me see if I can stable it. Okay, you can see it now? Yes.
No.
Oh my God.
Oh God.
Let me show you. Maybe you should look at my screen, sir.
Try to get the screen.
Okay.
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 I can't.
You can't.
I can't.
Wait, let me do something. Let me take off my background. Maybe that will help.
Okay.
Let me take off my background. All right. I'm sure this one will help.
Let me show him on the side.
Oh, okay. Okay, good.
Which of them?
1 minute, I just hold on, I'll show you now. Can you see this?
I'm seeing it. Okay.
What is it?
There's no fear. Okay.
Look at the screen. Yeah.
Yeah, that's the product we're talking about. It has the tendency of injecting calcium and vitamin K into your system. That will help the bones to come back to become strong. And then also you need the crystal cell. Did you go to crystal cell, please?
I think I saw that, Krista.
Yes, this in case of any those internal wound that will be there, that will help you to heal anything that's happened to them because you have already undergone surgery. So for quicker healing when it comes to the wound, this one will solve the issue. Then the double stem cell, because you must rejuvenate all the cells of the body around that area. You have it, right?
I've been
So
using
this, all right. So that these three products will help you well. Now, you know, one thing again about the Snowy 40 is that it has the tendency to do what Ultra Plus could do. That means it could help you build your immune system as well as control the level of cholesterol in the system as well. So if you have vitamin K injected and calcium injected, you should be fine. So this will help you, sir.
Thank you very much.
Yes, sir.
Okay.
Yes, sir.
Okay. Also have sorry. Okay, let me see what else. We have Benson Guys. Okay, you can unmute yourself. It's another, you can please mute your mic. So Benson Guys, you can unmute yourself and ask the question. Okay. If you're not there, let's take Blessing again. Blessing again, you can unmute yourself.
Hello, good afternoon.
Yeah, okay. Good afternoon.
Good evening. Good evening. Can you hear me?
Yes, can
hear you. Can hear you.
Okay, Don Jeff, this is the second time I'm listening to you. I'm really amazed at all your testimonies. I just wanted to ask, you be doctor? Oh my goodness. And then, you know, you cracked me up when you said, when I go in, I just discharge. That was funny to me. When you say now you're taking this. Okay, I have a couple of questions, please. I just want to know what you recommend for these conditions, right? Because I know people use these products in different ways. For infertility, what do you recommend, please?
Okay, the same three, the super three, they are what I recommended.
Okay, that's the same thing.
The same
Let me just, okay, so I don't waste time. I wanted to ask you the same question for infertility, stroke, blood pressure, and sickle cell. The same three?
Good. The same product, but for in the case of stroke, you will double this product. That's what I do is to double the product. And then I must always tell you that my Snowy 40 is my key, because the more you pass out anything in the system and take more for the water to refresh yourself, the liver continue to do the job of filtration, and in the course of that, anything in the system will definitely go out. So
okay,
you must always take the crystal cell, the Snowy 40.
Okay, and you say double the. You say the products you take the snowfield first in the morning before eating.
Yes.
And then double stem cell.
2 of it. And crystal cell 2 of it again at night before you sleep.
I can't hear. I can barely hear you. Please.
Sorry, can you hear me now?
Yes.
After the Snowy 40, the double stem cell should be taking double. That's two sachets in the morning, and then crystal cell 2 sachets at night. But
okay, that's
for I'm talking about the infertility case.
Okay.
But you need to also understand this patient if maybe the person has treated any infection before. Because you need to really ask. It's only when you ask they tell you.
Yeah. Okay, so I can tell them to take snowfield first in the morning, fasting, and then how long do they wait before they take double stem cell?
My case is 20 minutes after I take that, you can go with the double stem cell.
Okay.
But you must be a friend to fluid, water. You must take water a lot. Yeah.
Okay, and then the crystal cell?
That's lasting at night.
Okay, thank you so much.
Welcome.
Go, doctor. Thank you.
Doctor of science, not medical doctor.
Thank you.
Thank you.
Okay, so we have
Okay, let me answer somebody. I think I've seen this question 3 times. This is the third time. Head pain, back pain, and having like electric shock or sensation. Okay. Anything inflammation, you need to look at your double stem cell. It's good for that. The double stem cell is your key when it comes to inflammation. The chief pain relief is this guy. So if you're consistently feel pain, just begin to take your double stem cell without stopping. That will help you more. Yeah, the double stem cell. Thank you so much. So if you have anything that has to do with inflammation, pains, the double stem cell is your best bet. Then I don't know the type of shock you're talking about. If you say shock like as in your body discharges adrenaline so fast, maybe somebody just scare you a little, you go off. I don't know if that is the kind of pain you're talking about. If that's the kind of pain you're talking about, then we need to look at your blood pressure. If your pressure is high too, you may be experiencing that excess discharge of adrenaline in your system. So you also need to take that kind of a thing. I would advise anybody to take Snowfie so you can discharge whatever you think is inside the system as well.
okay. All right. I'll have sorry, this name, I don't know if it's G. Can you help us with it because I'm probably following. I just have G there. Then I have Soroko. Please unmute yourself. Soroko. I don't know if I pronounced your name right.
Hello, good evening, doctor.
Good evening, sir.
I guess that's a name that has come to stay permanently for you.
Oh my God.
Okay, so straight to my questions. I have 2 questions. The first one is, now I've worked with a medical sales company before where we had medical students or pharmacists market medicine, especially for diabetes and all that, and they had licenses. So I'm thinking, since we are into medicine, I don't want to say drugs because we don't do drugs. Since we're into medicine, don't we need licenses to actually market these products? Would we not be, would the medical guys not be after us since we don't have licenses to sell these medicines? Let me let that one fly first.
Okay, Didi, maybe I'll answer this. Didi, you take it up.
Thank you.
This product is NAFDAC registered. It is not a drug, and it's not a supplement as well. It's a therapy. A therapy is just a catalyst, something that will speed up a reaction. So that is one. So it is.
Right. Let me call him and find out how much it's going to get cost to send it to New Jersey with USPS. Then I go back to you. Thank you very much.
Okay, are we still on the same question, or are you asking another question?
Still on the same question, please.
Okay.
Okay, I got another voice now. I didn't get what you said now.
Okay, that wasn't me.
I had. Was that you again?
No, that was a different person. I think that's somebody answering a phone or something like that.
Oh, okay.
So, yeah.
All right, so continue.
So like I just said, this is NAFDAC certified, so that means it could go to any market. The most important thing that regulates any sales of any product, especially when it's going to either food, drugs, or anything, it has to be certified by NAFDAC, and our product is certified by NAFDAC. That's it. More reasons why we are selling it. Like let me tell you also that even at the time I had to go back to this same hospital because the chief surgeon that really dealt with my case, I took the product to him and I dashed him a packet because I told him one thing. I said, where medical science have failed, natural and plant science have taken over. Because when he saw me, he was shocked to have seen me this trimmed and I see my stomach gone back to 0. So he was like, what happened? I said, where you failed, somebody has done something. And he said, who is that person? And I brought out the PhytoScience product and I gave it to him. That's what, I must tell you the truth. I'm not just saying it because I want to say it. He has recommended at least 3 different persons to me. So part of my testimony very soon. Yeah, he will tell them straight that he has something that somebody could give to them, only if they have the money. And they come. I'm serious I've done it. In my team, I have 3 doctors. I have 6 nurses in my own team today as I speak with you.
Yeah, okay, that's fantastic.
In our team, we have gynecologists in our team. We have a neurologist in our neurosurgeon in our team. And all that. We have pharmacists, in the team. So it's permissible under NAFDAC. It is registered as a supplement because there is no category called stem cell with NAFDAC as it is now. So the best place they could register it under was supplement. And since it's considered a supplement by NAFDAC, it's over the counter. You can pick it from anywhere. You don't need you don't need prescription for you to have it. It's just like you taking your vitamins and any other stuff.
Okay, I like the over-the-counter nomenclature. Thank you so much. That answers my question. The second one, for many of us in Nigeria, I don't want to be gender-based. Many of us in Nigeria come with protruding tummy after a while, maybe childbirth and lifestyle and all that. So, what is the best product you would recommend for pot belly, either for a pregnant man or woman?
Pregnant man that would never give birth.
Let me help him. Let me just say the name is bottom belly. When a situation whereby you put on your clothes, you tie your belt. Someone is telling me to laugh. When you put on, you don't see your belt. You dress up and come outside. Nobody sees the belt you put on. It's like somebody that is tying rope on the trouser. Okay. Whatever the case is, believe me honestly, constant consumption of our double stem, the Snowfi for double stem cell and crystal cell will help. Now, if you look at Wilito's picture before today, you understand what I'm trying to say. You will see that thing I'm talking about, that bottom belly thing is there. But he showed us something. He was taking both the double stem cell and crystal cell 2 morning to night. And today, look at how he's looking very skinny. Now look at me that I'm here. If I had my system here and I display a picture for you, not long ago I went to receive my ATM from Access Bank. That's like 2 weeks ago in Apapa. I was called to come and take my ATM. Maybe I came because I put on my nose mask. The customer agent and customer service agent told me, please, can you just take down your nose mask, please? I want to identify. I took out my nose mask. I said, if not because of this mark on my face, he wouldn't have said I'm the person. He said I'm not the one. He said because I said, no, because it's a bank. I was so curious. I was like, let me see the picture you're talking about. He showed me my picture I took in 2014 when I was still working with NACO. I shouted, I screamed. Everybody came to that screen like, wow, is this me? I was begging them to change it. I need to update that picture because if you see me then, I was very, very big and bloated. As at that time, if you look at the way my stomach was, you understand. But today, everything has gone. It's nothing. I did nothing more than my normal regular exercise, not even daily now, this weekly. But this guy, the Snowfi Ford, as well as this double stem cell has always been, they're always with me at the crystal cell. I was just taking it, and before you know it, I shrank up to this. So I was just small now. You can see my picture, you understand what I'm saying.
Thank you very much. Sorry, I want to do Oliver Twist, a very last one. Is there a standardized dosage of this product? Do you use in the morning or once a day, or just enlighten me? Thanks.
Okay. You will definitely meet some people that will tell you, take this once a day, take this one in the morning, take that one once in the night. But it's a fruit product. It's basically 100% fruit, and there's no amount of fruit you take that's overdose to you. Now I've just done something. I said one day I find it difficult to sleep, and I tried to do an experiment. I decided to take 4 double stem cells at the same time. What I saw was that between 3 minutes I slept off, and I woke up in the morning. That day I was finding it difficult to sleep, but that's why I just quickly took it, and that's all because I've heard success story of people who don't sleep and they took double stem cell. So I took 4. 4 is not an overdose, but normally if you hear, they'll tell you take 1 in the morning, 1 in the night, or 2 in the morning, 2 in the night. There's no overdose because it's fruit based. I don't think there's any overdose eating fruit.
Thank you very much. That'll be all. Thanks.
Yeah. In addition to that, usually what the company will recommend for you is that you do once a day for body maintenance, and if you're addressing ailments, then you increase the dose depending on what you're addressing and how intense it is. Then over time, you can step down again to maybe 2 or once a day. So really it's about what you're addressing. If it's just for body maintenance, if you do 1 DS a day, that's fine enough. Do your 1 DS a day and do your 1 snowfield, 1 sachet of snowfield. That is good. But of course, we're all addressing one ailment or the other.
So you need to double up or triple up depending on what it is. If you're dealing with a stage 4 cancer, for instance, you might have to even do 333. Because of the gravity of what you're addressing is intense, and you need to address it intensely as well. But once you're fine, you can step down back to 1 a day. I hope that helps. If I'm still on, am I still on? Okay.
Yeah.
Okay. All right. Thank you. We need to be rounding up now. Do we still have more questions? Great.
Mr. Emmanuel has something to say. Mr. Emmanuel, I see from his screen.
Emmanuel has said it since.
But maybe something came. But something came up. Look at his screen.
Just hold on. We'll get back to him. Let's give other people the opportunity to also ask. Grace, I need for wishing. Go ahead and unmute yourself, ma.
Good evening.
Good evening.
Good evening.
Good evening, sir.
Yes, good evening. You're welcome. Yeah.
Yes, I had your conversation since I've been with you. Now, I want to know how I can get these drugs. I need mostly for my eyes. I had a cornea transplant 2 years ago, and it was successful. But later, recently, the vision started fading. So I don't know. The one you recommended for eyes, I don't know how I can get it. And I would need for prostate too.
Okay. Sorry, who invited you?
Are you hearing me?
Who invited you? Well, I heard you very well, sir. Very well. So who invited
you? Professor Mrs. Agbaje.
Okay. You will get back to her, and she would help you get how you can get the product. You understand? So get back to her. Yes. She will have a team lead. They will guide you on how you can get the product.
She told one of my brothers at in Ogun State. It was that one that called me that I should join in on this Zoom meeting this evening.
Okay. So I'm going to send you my number privately. So you send me a message after this, so that I can get to know who your team is. They will assist you in the product. Where's your location, sir?
I live in.
Where's your location?
Songo here. Songo.
Ah, okay. You're around us here. So. Okay. Madam Anka, are you in the room? Can you please? Okay, I see your image is moving now, so I know you are here. Okay, please, can you please help me with that? Send my number to the name so that they can reach us after this. All right. So next, please give me a permission that you heard me. I don't know if you heard.
Can hear you.
Okay. No, that's Don Jeff. The person I asked to do. I don't know if you heard me. Madam Anka, let me see something. Let me see a sign. Are you here? Thumbs up or something. Let me see a sign. Okay, good. Thank you, ma. Okay, Ma Shogunle. Ma Shogunle. Okay, please unmute yourself, ma. M.A. Shogunle. M.A. Shogunle. Are you with us? Okay, Tahas, Nigeria. I will wait for M.A. Shogunle. Tahas, Nigeria, or mute yourself. Am I still on?
Yes, you are.
Okay. Both of them are not there.
Hello.
Okay,
hello, I'm there. Hello.
Right, we can hear you, ma. Hi.
Okay. Good evening.
Good evening, ma'am.
Yeah, good evening to everybody. I heard a lot about other diseases, hypertension, whatever, cancer, but nothing about hepatitis. Does it work on it too? Yes.
Okay. Then Jeff, over to you.
Well, we have I on my own in my own team, I've not gotten hepatitis, but we have success stories, about 3 different success stories on hepatitis. So people have published, I've seen videos. I don't know if you have had the opportunity of seeing this video. Yes, as you take the product can perfectly do that. The product can perfectly do that. These products are miracle performing products by the grace of God. So if you take them, like I've said, as far as you're taking them regularly, hepatitis will go. Somebody have given us to have a success story on that.
Okay, what should somebody with that disease take? What and what can?
The 3 flagship products can do well because it's all about rejuvenating the cell, rebuilding the cell, injecting vitamin K into the system, boosting your immune system, and then this displacement reaction that takes place. So your double stem cell, your crystal cell, and your snowflake fort will be good to do that. Then to increase your immunity, a particular product was designed for increase in immunity. That is Aqua Plus. So the 4 products could do for you, or anybody that has it.
Okay, thank you.
Thank you, sir.
Oh, but the product works for any and all kinds of diseases. Okay. Buster, please unmute yourself. I think that's our last question for the night.
I just want to ask about the cost, because I seem to be sending messages about the cost and no one is saying anything.
Okay. All right. For the cost, you need to get back to the person that invited you. There's a comprehensive list of.
So why is that? Can I ask a question? Why are we being evasive about the cost? Why should we have to contact person?
So we're not being invasive at all. That's how it works, because we don't sell one word.
It's just to have an idea of the cost of what are you paying for. What is the cost of the item? You don't necessarily say, okay, I want to join a team or whatever. I just want to know the cost, full stop. How much is double stem cell? How much is whatever? And then we'll know what we're talking about.
Okay, ma'am. It's in packaging. So why we usually say get back to the person that invited you is this. The way we operate, we are not operating as retailers. So we don't want, I tell you how much it is now, you want to come buy from me, you're supposed to get back to the person. The essence of the meeting is for us to show you how this is. Now, if you take a decision that you want to go ahead and buy, then the best person is the person that invited you, that now I'm ready to do, can I see the price list? Now the person will show you all the packages. The packages, we don't sell double stem cell 1-1. It comes in package of 3, package of 6, package of 26, package of 32, package of 110. Now, if we start doing all that here, we get you confused. You're supposed to have a one-on-one after this meeting with the person that invited you here. We're not being invasive about the cost at all. It's out there in the open. So for the double stem cell, the package of 3 in Nigeria is 47,000, I think 300 or 600. For the package of 6 for double stem cell is 89,000. For the package 89,100. For the package of 26 is 356,100. Like that, like that, like that. But it's easier when you're having that discussion with the person that invited you, and the person can show you every single thing. For the snow filter, the crystal cell, the actual plus, we sell them in packages, package of 2 or package of 4. So we don't do retailing. But if you want to buy one, you still have to get back to the person that invited you. The person will be the one that will now say, okay, I'm going to give you one for a recommended price of maybe 20,000 or 25,000. But we do advise that you pick packages because it's cheaper when you pick package of 3 or package of 6 or like that. So it's not about being invasive, man. That's exactly how it is. It's in packages. So the person is in the best position to have time, spend time with you and educate you better. Are we good, ma'am? Boss, are you still with us? Okay, I hope that helps. Okay. All right.
Okay, sorry, I was muted, so I couldn't say yes or no. Sorry, like I said, I'm just doing it for information only, really. So it's just wanting to know whatever. I'm not saying I was joining or not joining, but I'm just saying I just wanted information to have an idea of what we're talking about, cost-wise, and that's all. Thank you.
Okay, so that's good. Okay, all right, ma'am. Thank you too. Okay, time is fast spent and we need to wrap up now. I don't know if we missed out any question. Any question? If we do miss out any question, please get back to the person that invited you. You always need to do that. It's essential so that there can be follow up. It's very important. There can be follow up as a huge as a big team like this. We can't get to meet your need personally, so you need to get back to the person that invited you, and whatever other questions that you ask that you have can be sent, and we can have that one-on-one interaction with you. Trust me, that's even the best. So if you want any what's that word? And I don't want to sound like a doctor, but there are some questions that we need to ask at times when you ask, can you take care of this? Can you take care of that? You might want to get a bit more personal, ask some questions that require that are private. So we always like to take that outside this. This is just like an overview to let you see what this can do, and have let you have an idea. Then for further discussions, then we can have that one-on-one with you. All right, so there's also a business side to this, and we have our business meetings every Friday at 8 p.m. as well. Tuesday, we just talk health, purely health, and Friday, we discuss how you can access this product for next to nothing for those that are interested in that, and how you can sustain, how you can maintain yourself using the products for free or for a fee. It's entirely up to you, and you can also use the platform to empower yourself and others around you. So join us on Friday 8 p.m. For that. All right. So at this point, I want to say thank you. Thank you so much, Don Jeff, Dr. John Jeff. You cannot run away from that.
I beg. Thank you so much, Didi. Thank you.
Okay, so okay. Doctor, doctor without degree.
Abio.
Thank you so much. There's nothing that speaks better than testimonies than your experience. You know that when you have shared from this thing, when you're speaking from inside, it's different than when somebody is speaking from the head. You've experienced it, you are a product of this, and that's why you do it so passionately. And we're so grateful for what God is using you to do with this platform. It's totally amazing. And ladies and gentlemen, this is why we do this. Imagine over 40 people being saved from one ailment. I counted like 12 and I lost count, and he said 40 in just about 3 months or so. It's honestly speaking, it's amazing. So imagine John Jeff didn't say yes. Imagine John Jeff didn't give a soft mind the opportunity, to show him this. That's 40 plus 40 lives that perhaps one thing or the other could have happened to, that maybe would have still been in that condition that they were before today. So it's important that when you hear this, please, 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 you can be fine, but what about those around you? Help us extend this information, spread this information, and get them to come and listen themselves. Invite them for our next meeting every Tuesday, our health talk, and every Friday our business talk. There's always somebody out there that needs this. You are privileged to have heard, and you are here today. Some are looking for this, they don't even know where it is. So we're asking, we're imploring, we're begging, we're doing everything to say, please, let's keep this, let's keep this spreading. Let's continue to share, 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 share. What you get at the end of the day, somebody will always come back to say, God bless you. God bless you for listening. God bless you for sharing this with me. God bless you. God bless you. God bless. That's what you keep hearing every single day. And it's such a delight when you know that you have impacted in somebody's life one way or the other. So thank you so much, Don Jeff. We appreciate you. Thanks to all the leaders. Thanks to all our invites. Thank you for honoring our invitation. And we do hope that you'll join us again on Friday and, of course, on Tuesday next week. All right, so do go ahead and get the product. All products are available now. Good news, all products. So go ahead, order Action Plus, Miracle Intense, Snowfield Forward, double stem cell, crystal cells, H2O, everything is available. So go ahead and order. And don't forget, we have up to 31st of October to take advantage of the ongoing promo. If you want to be a platinum for 356,000 naira, this is the time. You need to, get that sorted before the end of this month. Because after the 31st of October, platinum is 1.36 million. Hear me, 1,300,000, I think, and 65,000 or so. That's what it will cost you to be a platinum partner. So now you can spend just as little as 356,100 naira to become a platinum. My best advice, please go for it now. Go for it now. Okay. All right. So thank you so much. See you again next week. This is where we'll be drawing the curtain for today's presentation. So let me unmute everyone. Thank you all my co-hosts. Thank you all our guests, and thank you our wonderful Apple millionaires. We appreciate you all. Let me see. Where is the unmute again? Let me unmute everyone. Unmute, unmute, unmute. Okay, so you can all unmute yourself. All right, good night, everyone.
Good night.
Thank
you. Can I talk to you
Thank you,
privately?
Donja. Thank you,
Didi.
great leaders.
Thank
We
you.
love you.
Love you all.
Donja, that's your new
Donja.
additional name, Doctor.
Doctor of Science. I have a PhD in management science, so
Come
it's
on,
just Doctor
come
of
on,
Science.
go. God bless you, sir.
Thank you so much.
Thank you so much.
Thank you, Don Jeff.
Good night, everyone. God bless you.
Thank you,
Mama
everyone.
Didi,
Good
thank
night.
you.
Thank you. Thank you for the lecture, Doctor.
Thank you, Dr. Jeff.
Thank you. Greetings all the way from Little K.
Dr.
Don't be shy. Don't be shy.
Joining the three of us is a very special
Thank you, Lord, for everything.
This artist is no stranger to Prince. His designs have been worn and celebrated by the likes of Priyanka Chopra, Jennifer Lawrence, Anne Hathaway, and San Fran. He is at the very top of his work.
Bye, everyone. Bye, Didi.
Bye. Good night.
I retire now.
Time to sweep.
Excited to be here. Now, you specialize in print and pattern. You use it a lot. What are you hoping to see on the